Hey guys, it's Kristen from VetMed Math, and today we're going to be talking about total blood volumes. So there's a lot of different sources out there with different information regarding different blood volumes for cats and dogs. So we're going to discuss the implications of that information today. We're going to go through some of the most popular resources and exactly what the total blood volumes they publish are. So first up is dvm360.com. Now they go off of the 60 mil per kg for cats and 90 mil per kg for dogs, kind of the gold standard that we're accustomed to in veterinary medicine. However, you'll see with the following ones that that number could actually be much lower. And it is, of course, dependent upon weight. But as we'll see in a little bit, the implications are far-reaching of these numbers. So the IACUC is basically the Institutional Animal Care and Use Committee of Wayne State University. They published that a total blood volume for a cat is 57 mils per kg, and for a dog, it's about 85 mils per kg. Washington State University, they published that a cat has a total blood volume between 47 and 60 mils per kg and 79 and 90 mils per kg for a dog. UC Davis, highly respected, they went as low as to say that a cat has a total blood volume of 40 mils per kg and that a dog has a total blood volume of 85 mils per kg on average. And AHA, we get our fluid therapy guidelines from them, so they should know, right? They are stating that a cat has about 50 to 55 mils per kg total blood volume, and a dog has 80 to 90 mils per kg total blood volume. So now for the implications. Total shock doses. Criticalists have basically been utilizing the DVM 360 standard for quite a while now. However, we are seeing in cardiac and renal impaired patients that they need much lower of a total shock dose than what your regular cat does. And also, we are seeing that cats are getting fluid overloaded at these rates of 60 mils per kg. And that 40 mils per kg is probably a little bit better to start them off at, with 45 to 55 being the median range there. For IV fluid therapy, there's plenty of implications for maintenance rates and things like that, and things to consider when creating a fluid therapy plan. And the biggest one of all, blood donations and transfusions. So our donor to recipient math is based upon the 60 mil per kg and 90 mil per kg total blood volumes. In order for us to go ahead and calculate the particular rise in PCV that we want, or the total volume that we want to transfuse, or that a patient requires for transfusion, we are using these rates. However, it may not be 100% correct for these patients. So I'm interested to see what you're utilizing in practice. What is your shock dose, your total shock dose? Are you using quarter shock dose alloClots and doing fluid challenges? Is this affecting, your IV fluid therapy plans in practice? And for blood donations and transfusions, I'd love to hear if anybody is using any other formulas out there for calculating these things. Other than that, that's it for tonight. So if you have any questions, comments, concerns, if you need clarity on anything, hit me up in the comments, and I will see you next time. Thanks.